So this isn't about shaming. This is about understanding what makes healing harder and how to fix it. If you've ever had surgery, you've probably been warned about infection. Keep the wound clean. Don't touch your sutures. Finish your antibiotics. But here's the part they don't tell you. Your infection risk starts long before you walk into the office or the clinic or the hospital, wherever you are. And one of the most powerful predictors, that's metabolic dysfunction, especially in patients with obesity. So this isn't about shaming. This is about understanding what makes healing harder and how to fix it. So welcome everyone. My name is Dr. Mark Shankman. Welcome back to the Obesity Project, episode 71, why obese patients are more likely to get infections after surgery. So we're going to talk all about how obesity affects the immune system, like you see behind me. So in obese individuals, chronic inflammation leads to immune system dysfunction or lack of proper function. That sounds stupid, but you get the point. Not just overactivation, but impaired precision. So specifically, obesity disrupts a couple things. Neutrophil chemotaxis, that's the ability of the white blood cells to move across and get to the invaders. Macrophage polarization, which are the cells that actually engulf and break down these bacteria and viruses and other particles that are invading our immune system. And then cytokine balance. Those are immune system mediators that bring cells to the area, bring vascular or blood supply to the area. And so three things: neutrophil chemotaxis, macrophage polarization, and cytokine balance. These are the things that obesity disrupts. So there was a 2010 study in Nature Reviews, Nature Reviews Immunology, I should say, found that adipose tissue acts, which is fat tissue, acts as immunologically active organ. So it actually is a very active player in the immune system. And it releases pro-inflammatory mediators that impair proper immune coordination. And this was a study by Gregor in 2011. So an example of this, take a routine wisdom tooth removal like I do every single day. In a metabolically healthy patient, they might get some mild swelling and a pretty uneventful recovery. But in an obese patient with insulin resistance, now persistent inflammation, slow granulation or fill of the extraction socket, and potentially eventual abscess or infection taking over the area. Now, the bacteria, they weren't stronger. It was the host defense that was weaker. Their immune system was not working as well because of the obesity. And we're going to now talk about how hyperglycemia or elevated blood sugar fuels bacteria and blocks healing. So when insulin resistance is present, even if full-blown diabetes has not yet developed, your body struggles to regulate glucose or blood sugar. And so this leads to higher blood glucose levels, glucose-rich extracellular fluid. So that's the fluid immediately around the cells, separate from the vasculature, separate from the blood vessels, and impaired leukocyte response, which are white blood cells. I know this one's a little term heavy in terms of the scientific terminology, but try to stay with me. This leads to higher blood glucose, glucose-rich extracellular fluid, so more glucose in the fluid around the cells, and impaired leukocyte response or white blood cell response. There was a classic study in the Journal of Infectious Diseases that showed elevated glucose or blood sugar in wound fluid enhances Staphylococcus aureus or Staph aureus, a potentially very, very dangerous bacteria. Gets the biofilm is formed, and that's where the Staph aureus starts to set up shop. And this is a key factor in surgical infections. So the elevated glucose allows the bacteria basically to stick and attach itself easier which then leads to post-surgical infections. And this was a study by Callan et al. In 2016. So let's use an analogy. It's like feeding the enemy. The more glucose available in your tissues, the more energy these bacteria then have to colonize and grow. So now let's talk about surgical sites in obese patients that have poor vascularization or poor blood supply. So here, fat is poorly vascularized. So there's lack of good blood vasculature or blood vessels that go and provide nutrition to the fat. And surgical incisions then pass through or lie near fatty tissue that suffer already from lower oxygen levels or oxygen tension, reduced immune cell access, so reduced ability for the immune system cells, the white blood cells, the macrophages that actually engulf and destroy those invaders. So that reduces their access, and then slower clot formation as well. So in a 2014 paper in Wound Repair and Regeneration, they found that subcutaneous adipose tissue or fat tissue in obese patients has impaired angiogenesis, which is the creation of new blood vessels in the area of these cells. And so this then led to increased surgical site infection risk. And this was a study in wound repair and wound repair and regeneration by Pierpoint et al. In 2014. So in a deep neck space infection or in jaw surgeries, like I see many times, patients with high BMIs or high levels of obesity often show persistent erythema, which is redness, and oozing, even when protocol is followed. Now, why is that? Well, it's because the tissues cannot mount a proper defense or clear debris effectively because of these high glucose and because of the poor vascularization. So the other thing that obesity does is it alters the oral microbiome, the bacteria, viruses, fungi in the oral cavity, in the mouth, and the risk then starts really before the very first cut, before the surgery actually occurs. So the connection between metabolic health and oral pathogens are real. There was a study in Frontiers in Cellular and Infection Microbiology in 2020, which showed that obese individuals had a more pro-inflammatory oral microbiome or a more inflammatory set of bacteria in their mouths with higher levels of certain potentially pathogenic bacteria called Fusobacterium, Prevotella, and Porphyromonas species. So these organisms don't just cause gum disease, they're opportunists. And when you introduce a surgical site, now there's an opening for these opportunists to get into that tissue and they take advantage and create infection. So let's take a case example. So let's say there's a patient with insulin resistance that undergoes implant placement, right? Dental implant placement. No antibiotics are skipped, no signs of external contamination. Yet site shows breakdown, necrosis, which is tissue death, and periimplantitis, which is inflammation and breakdown of the biologic structures around the implant within 10 days. Now, why is that happening? Well, because of the internal terrain. The metabolic environment was already primed for infection before we put that dental implant made of titanium, but basically a foreign object, into the jawbone and into the gum tissues. So let's talk about how to reduce your surgical infection risk before you're on the table or before you're in the chair. So you don't have to be a victim of your metabolism. You can prepare your body before surgery to dramatically improve healing and resistance. So here's how. You want to normalize your insulin levels via low carb, ketogenic, or carnivore eating. You want to reduce visceral fat to improve oxygenation and circulation. You want to prioritize proteins to support tissue integrity. You want to avoid seed oils and sugar, which both drive immune system dysregulation or kind of mess up the immune system function. And you want to ensure optimal vitamin D and zinc. Both of these micronutrients are critical for proper immune system function. And there was another study in surgical infections in 2015 that showed that patients who underwent pre-op metabolic optimization had 30 to 50% fewer infections, even without antibiotic changes. And this was a study done by Thorell et al. In 2016. So this is all about controlling the terrain, controlling the pre-existing surgical field before surgery actually happens. Although the surgery may be clean, but the body isn't always ready. So this has been episode 71 of the Obesity Project, why obese patients are more likely to get infections after surgery. So just know this, if you're overweight, your immune system isn't just slower, it's confused. It's dysregulated. Your glucose is feeding the bacteria in the surrounding tissues. Your fat, that's starving your tissues. And your recovery is already at a disadvantage before the very first incision is ever made. But I'm here to tell you that you can fix the signal. And when you do, your healing improves, your risk drops, and your outcomes change. So don't forget, we're cutting through the myths and we're getting to the root here on the Obesity Project. Thank you so much for watching. I hope and pray that you learned something today. I want you to understand that obesity can be reversed. You can become more metabolically healthy, and you can do it all before you are under the knife, before you have any surgery. So make sure to like, share, and comment. Make sure to hit that subscribe button, the bell notification to get notified when new videos hit. I appreciate you. I appreciate your attention, and I'll see you in the next video. Take care.